Pyrexia of unknown origin. Definition: it's a fever of at least 3 weeks duration, temperature elevated above 101 degree Fahrenheit or 38.3 degree Celsius, and it remains undiagnosed after thorough history taking, physical examination, and intelligent and intensive investigations. At least 3 outpatient visits or 3 days in a hospital. Coming to the types of PUO, classical PUO we already discussed above. Nosocomial PUO, this of temperature greater than 101 degree Fahrenheit on several occasions, develops in a patient after 24-hour admitting to the hospital. Cause not found in 3 intelligent investigations includes at least 2 days incubation of cultures. Neutropenic PUO, this of temperature greater than 38.3 degrees Celsius and the neutrophilic count less than 500 per ml, and 3 intelligent investigations, still cause not found, that includes incubation of cultures. And HIV associated PUO, this of temperature greater than 38.3 degrees Celsius on several occasions. Coming to the duration, for outpatient greater than 4 weeks, for hospitalized patient greater than 3 days, and the HIV infection is confirmed, and this also of 3 days of intelligent investigation, still the cause not found, and it also includes 2 days of incubation of cultures. Coming to the causes of PO, the most common causes are TB, malaria, and typhoid and HIV. Coming to these causes, infections, coming to the bacterial infections, abscesses, most common is subphrenic abscess, TB, disseminated TB, it's seen in the immunocompromised and the chest X-ray is normal. Coming to the urinary tract infections and infective endocarditis, culture negative endocarditis, these are caused by the organisms of HASEC groups, and hepatobiliary infections like cholangitis without any local signs. These are normal and mildly elevated LFTs, and osteomyelitis, brucellosis, and Borrelia recurrentis. And rat bite fever is caused by Spirillum minor, and the Lyme disease is caused by Borrelia burgdorferi, and syphilis caused by the Treponema pallidum. Coming to the viral infections, herpes virus, those are CMV and EBV. These are seen in elderly, prolonged febrile illness without organ manifestation. Coming to the fungi diseases, it's seen in the immunosuppression state and intravascular devices throughout total parental nutrition. These causes disseminated fungal infection. Coming to the parasites, these are malaria, toxoplasmosis, trypanosoma, and rickettsial organisms. These are Coxiella burnetii and Q fever. Coming to psittacosis, these are Chlamydophila and Lepidopterism. These are caused. This is caused by the toxic fluids of the adult moth. Coming to the neoplasms, primary or metastatic. These hematological and non-hematological are there. Hematological causes are lymphoma, chronic leukemia, and non-hematological are renal cell carcinoma, hepatocellular carcinoma, myelodysplastic syndrome, sarcomas, pancreatic and colon cancers. Coming to the collagen vascular diseases, polymyalgia rheumatica, rheumatoid arthritis, rheumatic fever, SLE. And coming to the psychogenic fevers, habitual hyperthermia, afebrile PUO, exaggerated circadian rhythm, hysterical fever, malignant hyperthermia, neuroleptic malignant syndrome. And coming to the periodic fevers, these are a familial Mediterranean fever. Coming to the miscellaneous causes, these includes 10%. Those are drugs, penicillin, phenytoin, captopril, cimetidine, hyperthyroidism, pheochromocytoma, Addison's disease, and alcoholic hepatitis. These are the cause of PO, and also DVT, sarcoidosis, and hemolytic anemia. And now, how do you approach a case of PO? Coming to the history taking part, onset, acute cause is malaria and gradual is TB. Character, high grade fever, UTI. Pattern, there are sustained suspect of typhoid, and there are intermittent. If there is a daily spikes, malaria and abscesses, double quotidian, 2 daily spikes of fever. These are leishmania and gonococcal endocarditis, saddleback fever. These are dengue and leptospirosis, relapsing fever, non-falciparum malaria, and Hodgkin lymphoma. And antecedent causes are dental extraction, they cause infective endocarditis, and urinary catheterization causes UTI and bacteremia. Associated symptoms are chills and rigors seen in bacterial and rickettsial fevers, And night sweats, TB and Hodgkin lymphoma. Cough and dyspnea seen in miliary TB and PCP. And headache is seen in giant cell arteritis and typhoid fever. And sore throat is seen in streptococcal. Joint pain is seen in SLE, rheumatoid arthritis. Coming to the past history, ask about the malignancy. It may include leukemia and lymphoma, or diabetes mellitus, TB, heart diseases. Past surgical history, prosthetic heart valve, catheter, and AV fistula. Drug history, corticosteroids, anticoagulants. Family history, familial Mediterranean fever. Coming to social history, travel, amoebiasis or malaria, residential, malaria brucellosis, occupation, in farmers and slaughterhouses, brucellosis is seen. And coming to the diet, unpasteurized milk causes brucellosis, poorly cooked meat causes trichinosis. Intravenous drug users may end up in HIV or endocarditis and the close contact with TB. Coming to the physical examination, general examination, pattern of fever, weight loss, in hands, arthropathy, vasculitis changes, clubbing, in arms, skin rashes and nodules, and drug injection sites. Coming to the head and neck, feel for temporal arteritis, it may be tender and thickened, and eye, iritis and conjunctivitis seen in Ritter syndrome, a jaundice in ascending cholangitis. Coming to the fundus examination, choroidal tubercles seen in miliary TB, and rod spots seen in infective endocarditis. Chest examination, bony tenderness seen in acute leukemia, CVS, changing murmurs seen in endocarditis, RUPS seen in pericarditis, respiratory, pneumonia and TB, abdominal examination, C for hepatomegaly, may suspect hepatoma or abscess mets, splenomegaly may suspect of malaria, renal enlargement, renal cell carcinoma, and testicular enlargement, seminoma. And perrectal examination, C for prostatitis, and others are nervous system examination, signs of meningism may seen in chronic TB and meningitis, focal signs may seen in mononeuritis multiplex in polyarteritis nodosa. Coming to the investigations part, stage 1 investigation, these are the screening test, CBC, ESR, RFT, LFT, blood culture, sputum culture, stool culture, chest x-ray and ultrasound abdomen. Coming to stage 2 of investigations, lab investigations, protein electrophoresis, CT chest or brain, autoantibody ANA, RF, ANCA, ECG, and thyroid function test, and lumbar puncture, coagulation workup, temporal artery biopsy, Paul Banal and Whale Felix. Coming to the stage 3 of investigations, echocardiography, PET scan for malignancy, liver biopsy, bronchoscopy, and technetium 99M for acute infection and inflammation of the bone tissue. Coming to the treatment part of PUO, treatment of underlying cause identified after investigation and use of empirical broad spectrum antibiotics and therapeutic trial of aspirin or steroids and naproxen challenge for malignancy and lymphoma, empirical anti-tubercular treatment. Thank you.